Congress.
I think it's fair to say that the biggest issue on Wednesday night is whether or not the president is going to maintain support for the public option, the idea of a government-run insurance plan. Governor Dean, if the president on Wednesday night says, look, we just don't have the votes to pass the public option, we're going to have to go for co-ops or a trigger that some years down the line, maybe 3-4 years down the line, would trigger and initiate a public option, is that unacceptable? Is that a defeat for health care reform?
The problem is it won't work. It doesn't add anything. If you're going to do that, just do the insurance reform. Then I would agree with Senator Alexander. If you're going to do that, then don't pretend you're doing reform. There's no point in spending $600 billion and giving it to the insurance industry. We know what they'll do with it. So, you know, I'm very hopeful that he will stick to his guns and that we'll have the reform that we were promised in the campaign. But if for whatever reason he chooses to go in a different direction, then I'd scale back the bill. I wouldn't spend 5 cents on it. You know, we've done that insurance reform here. We did it 15 years ago. It didn't cost a nickel to do it. So if you're going to scale the bill back, then let's just not call it health care reform, because it won't be. It'll be insurance reform, and insurance reform is a good thing.
Mr. Podesta, and let me bring you back into this, because this is less a debate between Republicans and Democrats than between Democrats and Democrats. If the president says he's going to go for the trigger, and the idea would be private insurance companies would have, let's say, till 2013 to offer an affordable insurance policy to 95% of Americans, otherwise the public health option kicks in. But if they do offer that, there is no public health option. If he goes for the trigger, can and should Democrats live with that?
Well, look, I think that I agree with Governor Dean about one thing. We got to have affordable coverage and we have to have competition in the system that doesn't deny you coverage when you need it, that isn't built around excluding people with pre-existing conditions. I think the best way to get there is with a public option. I hope the president stays with that, because I think it provides effective competition and will produce the best result. But if he chooses to look at the overall bill and say that there's another way to get there, then so be it. We've talked about this a lot. It's time for people to get in and vote and see where the votes are in this Congress. But I think the idea of expanding coverage, I think what I would disagree with Governor Dean about is that spending money to give people, we have 14,000 people a day losing their health insurance coverage, spending some money to cover more people is worth doing.
Well, the only problem is I don't think you'll end up covering more people. I think you'll just drive the system into chaos because of the expenses. Look, this is an industry that its costs have gone up at 2.5 times the rate of inflation. The private insurance industry is not the salvation or the solution to American health care reform. It just isn't. And so I think you're going to have to expand public programs in some way. I thought the Democrats and the president did a great thing as soon as they expanded S-chip, as soon as President Obama took the oath of office. That kind of stuff is important, and public programs have a role. I know that Republicans disagree with us, but Medicare has been incredibly successful. That is how you're going to get people covered. You're not going to do it by giving money to private insurance companies. It's just not going to work.
Let me bring Speaker Gingrich into this conversation. First of all, I'd be curious to hear your take on what both of your Democratic colleagues here in the panel are saying, but also the 2003 Medicare prescription drug benefit bill, which President Bush signed, had a trigger in it, a trigger that's never been pulled. If President Obama now supports a trigger, that would give private insurance companies, let's say, 4 years to provide an affordable insurance policy, would that be more acceptable to Republicans?
I don't think so. I mean, the 2003 bill had a trigger which said specifically only non-governmental entities could be developed. It did not have a trigger that led to government, because if you say to the government bureaucracy, as long as you find it has failed, you get to build a brand new bureaucracy, you have a guarantee the trigger is going to go into effect. I mean, you're only delaying for 4 years what will become a 100-year problem. Let me just make and I agree with Senator Alexander from this standpoint. Mrs. Clinton came to see us in 1993, and we gave her our best advice, which is don't do a comprehensive bill. I said to her at the time, do 1 bill a year for 8 years, assuming you get reelected. After 8 bills that get through and signed, you'll have significantly changed the system. No one can write a single bill. If the president comes in Wednesday night and says, instead of a 1,300-page bill, I want a 1,200-page bill, and I think what Mr. Podesta said was very important. The country actually is not as interested in what the president wants as what the country wants. The country has for 2 months been trying to tell the president it does not want government rationing. It does not want bigger spending. It does not want decisions centralized in Washington. Now, the country's been pretty clear in 1,000-person town hall meetings, in every poll I've seen. The Gallup data is devastating on this. If the president were to come in and say, let's try to get 5 bills between now and Christmas. Let's get litigation reform, which is the most popular single thing. Let's get reform of paying the crooks in Medicare and Medicaid, which 88% of the country in Zogby said they would like to have as a first source of money. Because our estimate is you got $70 to $120 billion a year of theft. There are a number of specific bills you could pass with huge bipartisan majorities. The country would calm down. The president would be much stronger by Christmas, and we get a lot done.
All right. Perhaps the most remarkable fact of this entire debate is that with a Democratic president, a pro-reform president, and big Democratic majorities in both houses, that health care reform is in such trouble. Let's take a look at the different ways that Mr. Obama has tried to sell health care reform over the last few months.
It includes a historic commitment to comprehensive health care reform, a down payment on the principle that we must have quality, affordable health care for every American.
Over time, what we can do is bend the cost curve so that instead of having inflation go up a lot faster on health care than everything else, it matches everything else.
They're going to be more regulated so that they can't deny you care because of a pre-existing condition, or because you changed jobs, or because they've decided you're too sick and not a good risk.
Governor Dean, fair to say that when you offer 3, and maybe it's actually 4 or 5 different messages, that means you don't have one message?
Well, let me just correct something the Speaker said. You know, it is true that people don't want rationing. There is none in the bill. It is true that people don't want death penalties. There aren't any in the bill. So a lot of the things that you heard at the town meetings were essentially straw men set up by the right and then knocked down by the right. But none of that stuff is in the bill. Look, I think all 4 of us would agree that the president needs to give a strong, clear message about what he wants.
And has he done so, Governor? Has he done so far?
Well, I think that he has, but you know, that was the whole purpose from the Republican side of trying to muddy the waters and bring up all these issues that had nothing to do with the bill over this summer, and we got debate on those things, but that really wasn't debating about anything that was in the bill. So I think the president gets another chance to clearly say what's in the bill, what he wants, and that we're going to move forward. The president is the president. He was elected by a very big majority. We have very big majorities in the House and the Senate. My experience in politics is if you don't use your majorities, you lose your majorities.
Senator Alexander, I want to ask you about something the president almost certainly won't talk about in his speech on Wednesday night, and that is the idea that that Democrats may decide to just ignore the Republicans and push health care reform through the Senate through a parliamentary device associated with the budget called reconciliation, which means they won't need 60 votes to prevent a filibuster. They'll only need 51 votes. You have said, and I quote, that would wreck the Democratic Party and create a, quote, minor revolution in this country. Why?
Well, for 2 reasons. One, it'd create a bad health care bill, because under the provisions in the rules, the parliamentarian would write the bill, so all the senators would be voting on are tax increases or Medicare cuts, and you wouldn't get to put in the bill things like pre-existing conditions or buying insurance across party lines. So it'd be a bad bill. Second, it would be thumbing your nose at the American people who've been trying to say to Washington for the last several months, slow down. I mean, too many Washington takeovers, too much debt, you're meddling with my health care. Let's go step by step and do some things to reduce costs. So thumbing their nose at the American people by ramming through a partisan bill would be the same thing as going to war without asking Congress permission. You might technically be able to do it, but you'd pay a terrible price in the next election.
See, actually, Chris, I disagree with that. I think this has been used 23 times before, including by George Bush's really controversial tax cuts when he first got in. And I don't think the American people care about the process. I think they care about the result.
Let me pick up with you, Governor Dean, on another issue. At a town hall meeting the other day, you explained why you think that some limits on malpractice lawsuits are not in the bill. Let's take a look at what you said.
The reason that tort reform is not in the bill is because the people who wrote it did not want to take on the trial lawyers in addition to everybody else they were taking around. And that is the plain and simple truth.
Not take on the trial lawyers. Governor Dean, would tort reform be a reasonable way to cut health care costs And would it also be a way to reach out to Republicans?
First of all, I don't think if you put tort reform, I went on to say, if you put tort reform in the bill, you wouldn't get a single additional Republican vote for the bill. I mean, because there's going to be plenty of stuff. I mean, the Speaker's already said he doesn't like even a trigger option. So you're not going to get Republican votes for this bill. And I thought Senator Grassley and Senator Enzi made that pretty clear. We might get one. And I think to focus all our energy on the hope that we'll get one Republican to vote for the bill probably is a mistake. I think when you're putting together a bill like this, you try not to take on every single interest group. And I think the President has done a terrific job with that, much to the dismay of some of the Republican senators. He has worked closely with the AMA. He has worked closely with the pharmaceutical industry, the hospitals industry. The hospitals people have been denounced by some of the Republican senators for working with the administration. But I think that he's done what he has to do to set the table for a bill. Look, I don't think this bill's in bad shape at all. I've seen polls that show that we're in pretty good shape. The President has an opportunity to clear up a lot of the confusion that's been sown in some of these meetings. And I think when he does, people are still going to want real reform.